Good morning, everyone. Today we're going to be working on getting into the hips, really specifically looking into getting into the anterior hip compartment. I want to use the shin box, kind of our anterior hip movement, as a assessment early on, go through frog, V-sit, and then our half kneeling progressions in order to kind of work and open up those areas, and then come back to the shin box to see how much different it feels at the end of the session. So we were going to use the staff today, and if you tend to have sensitive, inflamed knees, I suggest having a pad, towel, blanket, something you can roll up, because we're going to spend a little bit of time in the half kneeling position. All right, let's get started. We're going to start on our back, making our nice big C shapes with our hands, placing hands below ribs and above the pelvic bone, right in that nice meaty space of the abdominal wall. Getting that nice squeeze, feel the thumbs press into the low back, the side palm pressing into the side body, and the index finger pressing into the abdominal, the front abdominals, into the belly. On our inhale, want to expand out like a crocodile or like a balloon, pressing out and away, forward into the belly, out through the side and into the low back. On the exhale, draw the navel all the way into the spine. Full exhale. Try to get all that breath out as much as possible. And then immediately inflate, filling up that balloon, pressing out on the fingers and the hand. With each one, on your inhale, see if you can expand a little bit more out. On your exhale, allow the hands to squeeze in order to create a little bit more resistance for your inhale. With each breath now that you're kind of feeling that inhale expansion, notice where that breath goes, and notice, more importantly, where it struggles to go. Does it fill up into the belly faster than it does into the low back, or out through the side walls of the abdominal wall? And even more importantly than that, does it fill up more to the right side or to the left side? Which side does it fill up less? Does it not want to open and stretch on that inhale? After a couple more breaths in and out, we're going to slowly shift into our shin box position. And we're going to spend just a little bit of time really want to assess the anterior hip and the adductor space. So getting into shin box, I'm in my left side shin box, left hand is down, left knee is bent, and my chest is facing towards the left side. That is my left side shin box. Allow that left elbow to spiral out and away as you ground downward into the palm, and feel the chest kind of opening up towards the ceiling. Inhale, see if you can feel your back hip drop down towards the floor. It does not have to touch, but if it's able to touch, that's fine. On the exhale, we're drawing navel into spine as we roll that pelvis over the top, lifting it up, bringing it off the floor. Inhale, dropping it back down. Exhale, lift and roll over. And as we roll over, we're going to mildly scoop from the tailbone, like we're trying to reach it forward at the same time that we're drawing navel into spine. See if you can feel some stretch through the front of the hip. How tight is that stretch? Do you feel it more through the outside edge of the front of the hip? Do you feel it more through the groin into the adductor space? Where does it feel strongest? We'll do 5 to 10 breaths, and then we're going to transfer over to the other side. Again, grounding palm, spiraling that elbow out, open up that chest. Right off the bat, you may notice that this side is tighter or easier to get into. Doing the exact same thing. Inhale, filling up your crocodile breath. Exhale, drawing navel to spine. Going from back hip touching or trying to touch to mild scoop of the pelvis. How much range of motion do you have with this back hip, allowing it to drop down to the floor and then elevating over the top of the other hip? How does that stretch feel through the front of the hip? Do you feel it more to the outside edge or do you feel it more to the groin? How is it different on this side compared to the other side? And we're going to go ahead and do that one more time on both sides. Because again, I want to get a nice, clear assessment, one that we remember at the end of the session, so that when we come back, we can feel the difference. Inhale as you let that hip drop down to the floor. Exhale as we scoop over the top, drawing navel into spine. Second time around, it should be a little bit more mobile. So we can get into that opening up, scooping, feel that stretch. Where do you notice it? This side for me, pretty simple stretch right through the center of the front of the hip. I don't have a ton of stretch through the adductor. I don't have a ton of stretch to the outside. It's pretty dead center. We'll transition back to the other side again. Ground palm, spiraled elbow, open chest. This side for me, my left hip is kind of chronically in a compressed state. Just off the bat, it's tighter just being in this position. Inhale, as I exhale and roll over the top, I have a lot more tension and stretch in the adductor space. I wouldn't even call it stretch, it feels less mobile. It's just stuck. It's hard to get it to move. So this will be one of the areas I want to see if I can get this to move a little bit better by the end of the session. Once we get through our 5 to 10 on both sides, we're going to move into our V-sit position, getting the legs spread nice and wide. I want to actively reach the knees down towards the floor. Pressing down, you should notice your quads kind of lightly contract. At the same time, we're pulling the top of the foot back towards the shin. Again, both of these actions should fire up the quads. Palms are coming down to the floor, grounding. We're going to spiral those elbow pits out and away so they're facing the side wall, which helps open up the chest so that we get that nice lift up towards the ceiling. Before we do any other movement, we're going to get back into our crocodile breath. Inhale, filling out into that abdominal wall. Exhale, drawing navel in towards the spine. As you're feeling those inhale, exhales, now we're going to start to work our spirals synced up with our breath. So on the next exhale, we're going to rotate the knees out and away as far as we can comfortably. Inhale as we come back to center. Exhale as we spiral the knees internally as far as we can comfortably. And then inhale back to center. Exhale out. With each one, see if you can slowly squeeze inward and outward a little bit further. I want to feel this as much as we can up deep into the hip socket. Can you feel that rotational stretch taking place at the ball of the femur up in that hip? And again, can we get a little bit more range in each direction? And how does the left hip feel in comparison to the right hip? If you felt a difference in the shin box, you're probably feeling a difference here. I feel this a lot more through my adductor space on my left hip. My right hip feels pretty easy. Although as I'm going back and forth, my left hip is starting to open up a little bit more, especially compared to the first 2 or 3 reps. We're going to relax our legs, continue to actively reach the back of the knees down, pull the dorsum of the foot back. Again, quads are somewhat flexed. And now I want to get into a little bit of fold work so that we can get some length through the back of the legs into our low back. So nice inhale into our crocodile breath, exhale drawing navel to spine. We're going to slowly reach both hands evenly forward on that exhale. Inhale, allowing the hands to come back up to our body. This is where I like to imagine we're just a wave roll going up a beach on our exhale. Once we crest, receding back on our inhale. Again, I want fingers reaching evenly. I want to pay attention to one hand reaching a little bit further than the other hand. Can you keep both hands even, and can you squeeze a little bit more range on that reach on each one without forcing it? I don't want to go to pain. I don't want to go to stress on the back of the legs or the low back. Once we get to 5 or 10 reps, now we're going to start moving side to side. A little bit of a deviation from one side to the other. But as we do this reach, I again want to keep my hands perfectly even. I don't want one hand reaching a little bit further, because that means I'm reaching a little bit more, rotating through my spine. I'm reaching more from one shoulder. I want to keep both shoulders even as I go from one side to the other. And we can continue to reach further out and away, getting out to the heels. By keeping those knees actively reaching down, the feet pulled back, and reaching evenly through our hands, we should get some good assessment of how do the back of the legs and the low back feel when you're reaching to the left side compared to reaching to the right side. Is one side tighter, stiffer? Where is it tighter? Do you feel it more in the back of the knee? Do you feel it high up in the thigh? Do you feel it more in the low back? Or even, do you feel it on the opposite hip, in the anterior compartment of that opposite hip? All right, now we're going to shift into our frog position. So coming up to hands and knees. I want to keep the feet fairly close together, and the knees are going out wide apart. I want to keep the toes tucked underneath to start with, so that that big toe is kind of tucked and loaded underneath. Inhale as we're forward. We're going to exhale, drawing navel into spine as we sink our hips back to heels. Inhale, coming forward. With each one, as you exhale, we're going to see if we can sink a little deeper. And notice, where do you feel the stretch? Now, there's a number of places that we might feel it right off the bat. You might feel it in your inner thighs more on one side than the other, or you might feel them pretty evenly through both. I also want to pay attention to the big toe joint. As you're sinking back, does the right big toe feel like it's stiffer, tighter, more restricted than the left, or the other way around? How do the arches of the feel? Arches of the feet feel. My right big toe is definitely stiffer and a little achier. I even have a little sensitivity to the inside of the knee right now. So this is a position I want to make sure that we are not moving into pain on. I'm going to have you come back forward. So hands are more over the wrist, not deep in the hips. And we're going to do a little bit of pelvic mobility play in this position, and we're going to combine that into the frog. So on your inhale, let your belly fill up, and we're going to allow the pelvis to tilt down towards the floor. As we exhale, we're going to draw navel in and get our scoop, but I'm not sinking back. I'm staying forward on my wrists at the moment. Inhale, fill up that belly, allow the pelvis to tilt down. Exhale, drawing navel in and scoop. With each one, see if you can get a little bit more anterior tilt down towards the floor. See if you can get a little bit more scoop. Now I kind of want to combine this with our frog, our sit back. So as we're coming forward, we're going to allow our pelvis to scoop, tuck underneath, or tilt, scoop. As we reach back, we're going to inhale into our belly and allow the pelvis to tilt down towards the floor. It's almost like your tailbone is trying to lift up towards the ceiling at the same time that we're loading our hips into the feet. Inhale, scoop. Exhale, anterior tilt as you rock back hips to heels. Notice if that active pelvis gets you a little bit more stretch into the adductors or inner thigh area. If this is feeling pretty good, we can drop down onto our elbows and do the exact same movement. Again, continue to use that breath. Draw navel into spine as you move forward. Exhaling, inhaling, fill up that crocodile breath as your pelvis tilts down towards the floor. We're going to come back up to hands. Bring your body weight again over your wrists a little bit more. We're going to unload the ball of the foot so the feet can go nice and flat. I want to let the hips sink back just a little bit so there's a little bit of tension in the hips, but not a lot. And now we're going to lift our ankles. We're going to do some deeper hips. So deeper hip rotational mobility. So very lightly on our exhale, we're going to lift one ankle up, rotating through that hip, seeing how high you can come up comfortably. Inhale as we let it down. Exhale as we lift the other side. Still breathing into our crocodile breath. Exhale, navel comes in as you lift that ankle up towards the ceiling. With each one, see how high are you able to squeeze into it without going into pain or discomfort. How does this feel on the right side compared to the left? Are you able to go as high on both sides? Does one side feel tighter and more restricted? I feel like I got a good amount more range of motion on my right hip. Let me change my angle so that's more visible. So I feel like I got a little bit more range on my right side. I got a lot more tension and a little less range on the left. Go ahead and let both legs relax. We're going to stay in this position and we're going to do a little bit of our rock back, hips in between the heels. Kind of seeing if that has opened up a little bit more space in that anterior hip compartment. Does that feel like you got a little bit more mobility? Maybe you notice a little bit deeper stretch on one side more than the other. Then we're going to slowly come out of that position. And we're going to come all the way up into a standing position and we're going to grab our staff. So grabbing staff, we're going to get a nice shoulder width grip. So where I want to have that nice bending the staff. Remember, we're bending not just at the hands, but I also want to feel the shoulder, the elbow pits spiraling up towards the ceiling. And I want to feel the shoulder blades packing downward on the upper back, kind of packing down onto the rib cage. From here, I want to get a little bit of a scoop of the pelvis. So we're exhaling, drawing navel into spine. Feel that little bit of a scoop. Getting into our nice breath, crocodile breath. Inhale as we exhale. We're finding elbows to the ears, seeing how far back can we squeeze, but I want to maintain this pelvis, this scoop. I don't want my pelvis to tilt forward to where I get this big sway in the back and the rib cage sticks out. I want to maintain scoop, maintain the core. You should feel a little bit of engagement as we draw the arms up, squeezing back towards the ears on the exhale. Inhale, arms go forward. Exhale, squeeze. Again, we're bending that staff. Keep that bend active. And with each one, see if you can squeeze the elbows back a little bit more without going to pain. After 5 to 10 reps, we'll bring the arms down. We're going to move the staff to behind us. Palms are facing backwards. Still bending the staff, but we're bending it away from the body so the elbow pits are facing forward still. Notice how that spirals the arms, opening up the chest, and you should still be able to feel those shoulder blades kind of packing down on the rib cage. I want to continue to hold that light scoop in the pelvis so that our core is a little bit engaged. Inhale, filling up that crocodile breath. Exhale, navel to spine as we lift our elbows up towards the ceiling. Inhale as you let them drop, filling up the crocodile breath. Exhale, see if you can lift a little higher. Now, as we lift, I want to maintain our mild scoop, and I want to keep those elbows spiraled forward. This should, and actually as we lift, continue to spiral those elbows. Actively turn the elbow pits outward. That should help you feel more opening up through the chest. What I want to avoid is as you're lifting to lose your shoulders to where your shoulders round over the top of the ribs. I want to keep that nice open chest as we lift. In each one, see if you can lift a little bit more. Can you get a little higher without forcing it? After 5 to 10, we're going to flip our palms the opposite direction. We're continuing to spiral out and away. Feel that nice opening up of the chest, scoop of the pelvis, exhale and lift. Doing the exact same motion, just with a different hand position. This particular hand position, I want to notice the front of the shoulder. This tends to be an area where if you've got some bicep tendon issues, you're going to feel it more strongly in this particular side, on this particular position. Is one side, do you feel it more than you do on the other side? And after 5 to 10, we're going to go ahead and set the staff down for the moment. And we're going to do some bowls of soup. So bringing the arms out. I'm going to do my bowls of soup with my arms at shoulder level, but if you have shoulder discomfort, impingement, pain, then it's okay to bring them down to where you're not in a position of discomfort. They can even be all the way down by your side. I'm starting up high, so don't feel like you got to be in the position I'm in. We're going to spread the hands as wide as you possibly can and extend the elbows. We're going to start with the palms facing the ceiling. We're going to move one side at a time, but we're going to alternate back and forth. So keeping those palms spread, hands spread, I want to spiral not just at the wrist, but all the way up the long bone up to the shoulder. I want to feel that spiral turn through the entire arm. So as the palm goes from facing up, the elbows facing up, both turn to facing down, seeing how far can you spiral through in 1, You're going to spiral all the way back to open and then doing the same thing on the other side. I want to feel that ball of the humerus up in that shoulder socket spinning. I don't want to feel a whole lot of extra movement from the wrist or forearm. Can we get that movement all the way up that bone, long arm bone? As we're opening up, we're going to continue to open up and feel that stretch spiral in the opposite direction as we go from one side to the other. Notice which direction it moves better on each side. My right shoulder, as I spiral in and out, feels pretty smooth in both directions. My left, going in, I get a little bit earlier stretch, even more so as I come out. As I come out, oh man, that's a good stretch. I don't have as much mobility on that left shoulder as I do on the right. Making sure we're not going into pain and we're not trying to force it, but I want to move into that mild stretch to see if we can get it to open up a little bit. Simply just with nice, soft, juicy reps, keeping those hands nice and spread. And then we'll go ahead and shake the arms out. We're going to come down into our hands and knees, back into quadruped. Spreading fingers nice and wide, grounding palms. We're going to do a little bit of light wrist mobility, a little bit of foot mobility, before we do a little bit of spinal mobility. So before we get into our movement, I want to come back to our crocodile breath. Nice inhale, fill up that belly space. Exhale, drawing navel into spine. See if you can feel that expansion on the abdominal wall in all directions. Even though your hands aren't there, can you still feel that stretch? Not just forward into the belly, but into the low back and out through the sides. On your next exhale, we're going to start to lightly load the wrists. We're going to exhale and rock forward, keeping the palms grounded. Inhale, rocking back. Go as slow with your breath as you can. I don't want to get rushed on this. How does this feel on the right wrist compared to the left wrist? Much of the focus today is on the anterior hips, but anterior hip stuff will show up in the shoulders, in the elbows, and down into the wrists. So I want to notice any differences in the right wrist to the left wrist because it might be relevant to what's going on in your hips. Turning fingers out towards the side. Again, palms are grounded. We're going to get our side to side glide. Exhale, we're pushing through one hand as we're pulling into the other palm and doing the same thing in the other side. See how active can you feel the shoulder blades sliding and gliding along the rib cage. I want to feel that push from one hand be a push through the shoulder as it wants to reach off the shelf of the rib cage. And as I'm coming into that hand, I'm pulling into that palm and I'm feeling my shoulder blade pulling towards my spine. Again, how does this feel in the right wrist compared to the left wrist? Then we're going to turn our fingers all the way back towards the knees. Closer the hands are, the less intense. The further out we come, the more intense. Inhale as we go forward, filling up our crocodile breath. Exhale, drawing navel into spine as we lightly sink back hips to heels. Again, notice the difference right side to left side. Not uncommon for the more dominant side hand to be, forearm to be more tight and dense feeling than the non-dominant. So I don't want to make too big of a deal about it in this particular position. Then we're going to flip our palms over to the back side, allowing the elbows to bend. I want to pay attention to stretch in the elbow to start with here. So we're going to keep the back of the palms grounded, and we're going to push into the floor, into them lightly to extend the elbows, and then feeling for any stretch. If you got some mild stretch, that is great. That's exactly what I want to feel, and I want to move into it lightly and then allow it to bend, and then move into it lightly and allow it to bend. Again, just seeing if we can kind of lubricate and groove a little bit more range of motion out of the elbows without forcing it. If you can get the elbows extended fully without pain, then we can do a little bit of rock back hips to heels. Inhaling as we go forward, exhale as you go back, keeping the fingers nice and spread wide open, grounded through the back of the palm. And then we can come off the wrists, roll them out a little bit. We're going to come back to the wrist here in just a second to finish up with our feet. So coming back, grounding palms. Now we're going to tuck the toes and turn the heels in towards each other. I want to have just the big toe tucked and loaded onto the floor. The knees might splay out just a little bit, not quite in our frog position, but kind of, similar. We're going to inhale into our crocodile breath, exhale, drawing navel into spine as we sink back hips to heels. Inhale, inflating that crocodile breath. Exhale, drawing navel into spine. With each one, see if you can sink a little bit deeper into that big toe joint. Notice how does it feel on the right side compared to the left side. Is one side a little stiffer, a little tighter, a little achier? Is it painful? I want to make sure that we are not pushing into pain. Can we get it to be a little bit more mobile with a few gentle reps? Then we're going to turn the heels out, tucking all the way out to the pinky toe. See if you can get that pinky toe underneath so you got it nice, lightly loaded to the floor. Doing the exact same thing. Inhale into our crocodile breath. Exhale, drawing navel into spine as we sink our hips to heels. Inhale, slowly coming forward. Exhale, slowly sinking back. How does this feel on the right foot compared to the left foot? Does it feel tighter, more restricted? Does it feel disconnected? Does one side feel more connected than the other? Sometimes the side that you don't feel a big stretch on, you also don't feel much connection to, and that's a big deal too. So I want to notice not only where do I feel the big stretch, but sometimes I want to notice whether I feel as much, like is there a lot lesser sense of feel on one side. That may be a signal that I lack some neurology to that particular region of the body. That's going to be important. I want to pay attention to that. On the next one, as we sink back, don't go full back, don't go to full tension. We're going to kind of go halfway, and we're going to do our windshield wipers with our heels. Roll the heels all the way in like you're trying to touch them together so that we load to the big toe, and then roll them all the way out so that we load to the pinky toe. Try to keep it connected to the breath. By rolling in and out, you're going to be getting into some different mobility into that big toe joint. So notice how does it feel on the right side compared to the left. As you roll inward and outward, does one side feel different? Does it feel tighter, more restricted? Is it a little uncomfortable? My right big toe is definitely a little stiffer as I internally rotate the heels compared to the left big toe. Then we're going to untuck the toes, and we're going to let the hips sink back to heels, feeling into the front of the ankle space. Inhale, coming forward onto wrists. Exhale, coming all the way back, hips to heels. We can even start to load, bringing weight off the hands. How much can you sit back, hips to heels, without irritating the knee, without pain in the foot or the ankle? How does the right ankle space feel in comparison to the left ankle space? I'm noticing a little bit more tension in my right ankle than I normally have. So and my right knee feels a little swollen. There's a little inflammation going on in that knee. All right. We're going to come back to quadruped, or to our hands. Again, spreading hands nice and wide. Want the toes lightly tucked. And we're going to come back and get into our hip mobility and then do a little bit of spinal wave. So coming back to our breath, inhale into our crocodile breath, fill up that belly, allow the pelvis to tilt down towards the floor on the inhale. Exhale, as we draw our navel in, we're going to scoop at the pelvis, but try not to allow that movement to work up into the shoulders. I don't want to round the upper back. I want to keep the upper back stiff. In fact, to help keep the upper back stiff, let's spiral the elbow pits forward and feel the shoulder blades squeeze onto the rib cage, packing down onto the ribs like they're moving into the back pockets of your hips. And hold that. Don't let that move. As you exhale, scoop as much as you can without releasing the shoulders. Inhale, feel that belly open up towards the floor, getting as much sway in your back as you can without going into pinch or pain. With each exhale, draw that navel up towards the ceiling a little higher as you try to scoop the tailbone a little further. Can you feel that stretch a little bit in your low back? Do you feel it more on the right side of your spine or the left side? On your next one, as you inhale, when we exhale, we're going to release our elbows, letting them spiral in, pressing into the floor, releasing our shoulders and letting them reach towards the floor. They can go over the top of the ribs, getting into a nice big cat. Inhale, we're spiraling the elbow pits forward. Coming into our cow, feel that opening up of this chest as it reaches down to the floor and the head comes up. Tie it to your breath. Exhale as you scoop and press. Inhale as you tilt, belly opens up, sway in the back, and the chest reaches to the floor. Go ahead and come off your wrists. Again, we'll roll the wrists out a little bit. We're going to come into a half kneeling position. This can be done in a chair if your knees are overly sensitive, so that you don't put a lot of pressure on the knees. So if you need to sit in a chair, that is fine for really all of the next handful of movements that we're going to do. Also, if balance is an issue, it's okay to use a staff to give yourself a little bit of extra support. I'm going to go ahead and set the staff down for the time being. I want the back toe tucked, whether you're in the chair or on the floor. Back toe is tucked and loaded. And we're going to start by getting into that same pelvic tilt work, except we're working one side at a time. So inhale, filling up into our belly, allow the pelvis to tilt forward. We're getting that nice sway in the back. Exhale, drawing navel into spine, feeling that light stretch through the front of the hip. I want to keep the head, shoulders, and hips directly over the knee. I don't want to let my hips or my head come forward. So this is where the staff can actually be kind of helpful, because I can set that staff at my knee, and then it helps me keep my placement of my head and my shoulders. So notice as I'm inhaling, I'm getting this big sway in the back, belly's opening up, but I'm still maintaining the position of the head, shoulders, and hips. As I exhale, drawing navel into spine, feeling this stretch through the front. Again, head, shoulders, hips, all stay in alignment. With each one, see if you can get a little bit more active scoop. Can you feel that stretch in the front of the hip? Can you also feel that loaded stretch at the big toe? Again, I want that big toe loaded. If your heel is turned out, you're not going to feel this on the big toe. So you can try to turn your heel more to the midline of the body. That should get into that big toe stretch a little bit more. And then we're going to switch and do the same thing on the other side. So again, getting into the exact same position, load the big toe. Inhale, feel that pelvis tilt forward, belly opens up, big sway in the back. Exhale, navel to spine. Can you feel that loaded stretch through the front of the hip? Again, head, shoulders, hips, stay in alignment over that back knee. How does the front of this hip feel compared to the other side? For me, this gets into that left hip a lot. My right hip felt really good, lots of mobility, but I feel very restricted. It's hard to get that full posterior tilt of my left hip. Posterior being that scoop. When I'm scooping into it, my pelvis is moving posteriorly. When I inhale, my pelvis is rotating anteriorly. And we're going to go ahead and switch and do the same thing again on the other side. But this time we're going to add some lunge into it. So inhale, fill up the belly, nice sway in the back. Exhale, drawing navel in. Get that first stretch. And I want to try to actively hold our posterior tilt, the scoop of the pelvis. And now we're going to lunge forward. My lunge is going to draw me out of that scoop. I'm going to lose position of the pelvis, but I want to try to actively resist that so that I get some traction stretch. Once I get out, we're going to come all the way back in. Inhale, exhale, scoop, reactivate that first stretch, and then lunge and draw it out lightly. And notice, how do you feel that stretch through the front of the hip? Do you feel it more to the outside of the hip? Do you feel it more into the groin, inner thigh, adductor space? And we're going to do the same thing on the other side. Again, have that back big toe tucked underneath, loaded underneath. Inhale, filling up that belly, crocodile breath. Exhale, navel to spine as you lunge forward. Trying to resist that pull. We want to maintain our scoop as long as possible. Exhale, draw it in, feel that first stretch, and then resist as we move into our lunge. So on my left hip, it's harder to even get into my first scoop, and then I have a lot more stretch going into that adductor space, into that groin. The medial compartment of my left hip is where I tend to hold a lot more compression. Again, that's generally related to right side being very unstable, 5 knee surgeries in my right knee, dislocated big toe in my right foot. My right side is less stable, so my left hip gets tighter in order to maintain stability. We're going to go ahead and switch back to the other side. And I want to come back into our bowls of soup, but we're going to do one side at a time. So I've got my right knee down. I want to focus on my right shoulder. We're going to bring the arm straight out to the side. Again, if you got impingement, we can drop it down lower. Spread hands, palm is up. We're actively scooping at the pelvis. I want to maintain that scoop as we move internal to external. We're going to exhale as we spiral out. Internal, we're going to inhale. After about 5 of those, I want to see now if we can get our arm going straight up. We're going to do the exact same bowl of soup, but we're going to do so from our arm straight up towards the ceiling. Again, active scoop. We're spiraling out and we're spiraling in. And now we're going to add one more piece to this. As we spiral our arm out and we're inhaling, we're going to let our shoulder drop back down and back on the rib. As we exhale, drawing navel into spine and feeling that scoop of the pelvis so we get that stretch, we are also reaching as we internally spiral. So I'm seeing how long can I get my arm up as I spiral in. As I inhale, letting the pelvis go a little bit as I get sway in the back. I'm externally, actually that's internal spiral, sorry. Palms are facing in as I'm letting my shoulder drop. Exhale, I'm spiraling out and away as I reach. And at the same time, scooping the pelvis. There's a lot going on in this one. I will try to articulate that one just a little bit more. So again, back big toe is tucked. Inhale, draws my pelvis forward, big sway in the back. Exhale, I'm scooping. At the same time that I am scooping, I am spiraling my palm out and away as I'm reaching up. At the same time that I'm inhaling, filling up my belly, palm is spiraling in towards my body as my shoulder blade draws down and back. Again, sway in the back. Exhale, scoop, reach. We'll go ahead and switch to the other side and see if we can recreate that. If you're not getting this perfectly, that is okay. Doing this imperfectly is still mobilizing the shoulder, mobilizing the hip, and mobilizing the spine. So it's still good work, even if you're not able to sync it all together. So I'm giving you a lot of different cues on this one. We're going to come back out to palm up, out to the side, spread hands, active navel in, active scoop. Spiral, doing our bowls of soup through that left side for 5. Inhale as you spiral up and away. Exhale as you internally spiral. Again, how does this shoulder feel compared to the other side? After 5 of those, we're now going to go straight up, keeping those hands spread. Exhale as your palms are turning out and away. Inhale as your palms turn in towards the midline of the body. And now we're going to add in our breath with our scoop. So inhale, belly fills up, Pelvis is getting our big sway in the back. Palm is spiraling in as the shoulder draws down. Exhale, navel comes into spine as we scoop, externally spiraling as we reach up. All right, now we're going to go ahead and grab our staff. We're going to switch back to the other side. Nice tuck of that back toe. I'm going to bring the staff across the front of the shoulders. I want it to touch the front of both shoulders evenly. Both hands can just come up and support the staff to keep it in place. The staff is here in order to keep our shoulders moving together. We're going to get our nice scoop of the pelvis. That big toe again is tucked and loaded. Inhale, filling up our belly, pelvis goes forward. Exhale, drawing navel into spine, getting our stretch through the front of the hip. And now we're going to add in a rotation, turning towards the leg that is elevated. Inhale as we come back to center, letting that pelvis tilt towards the floor, big sway in the back. Exhale, scoop the pelvis, navel to spine as we rotate. And we're seeing how far can we turn our chest to the wall at our side without the staff moving off of one shoulder. It needs to stay both shoulders so that we're rotating with a square shoulder, square chest. Inhale as we come back forward. Get that nice stretch in the scoop and then rotate. If you got a good scoop, you should feel that stretch go from the front of the hip a little bit more diagonally across the obliques as you turn to that side wall. And we're going to do the same thing to the other side. Tuck that back toe, get that scoop in the front of the hip. Inhale, filling up the belly, sway in the back. Exhale, navel to spine as we now start to turn to the opposite wall. Filling up that belly on the inhale as you come to center. As you exhale, continue to draw in, continue to actively scoop as you rotate. This is a great stretch for me. This is getting into that, I feel that stretch through the adductor, and I feel how that is also related to rotational stretch through my spine. That's significantly different on this side compared to the other. And as I'm doing it, I'm feeling it open up and giving me a little bit more mobility, which is what tends to improve the function of my day. All right, we're going to step the staff down. We're going to come back into our shin box position. I want to reassess the anterior hip compartment. So I'm on my left side, palm is down, elbow spiraled out. Inhale, allowing that hip to drop down. Exhale, scooping into it. We'll do 3 to 5 on both sides, and we'll probably go back and forth a couple times. Just again, I want to have that, this is a reassessment. I'm comparing to how it felt at the beginning of the session. So once you get 3 to 5 on one side, we'll go to the other side. Grounded palm, spiraled elbow. Inhale, let that hip sit. Exhale, feel it roll over the top and scoop into it. Now I'm looking for minor improvements. I'm not looking for drastic or major improvements. If you get a major and drastic improvement, great. That's awesome. I like it when magic happens. It's pretty rare that it's major and drastic. I'm looking for small improvements. My left hip is still noticeably tighter than my right hip, but my range of motion is a little bit improved. I have more space that I'm able to move into the front, and I'm able to get that hip to drop a little bit lower down in the back. So my overall mobility has improved, even though the hip still feels significantly tighter in relationship. That's a positive sign. That is what I'm seeking when I do my movement sessions. We'll go ahead and come back to the other side. And I'm gonna go ahead and go into our folds, because I want to get some work through the back line of the hips as well. So in our forward folds, leg that is in front, I want that shin to be fairly square with the chest. We're going to inhale, filling up that belly. Exhale as we draw navel into spine, reaching both hands evenly through that shin. Seeing how far can you get both hands even. Inhale, we're coming all the way back up, filling up that belly. Exhale, navel to spine as we reach. We're doing 3 up to 5 reps on this side. With each one, seeing if we can reach a little bit further. And then we're going to transition to the other side and do the same thing. Get a nice square shin. Inhale, filling up the belly. Exhale, reaching both hands evenly. Again, I want to keep both fingers even. I don't want one hand moving farther than the other. If one hand's going further, it means that your back is a little bit rotated. That gives you more space for that side. I want even in order to assess. It's easier to assess if I keep fingers evenly. Then I can feel, how does this feel specifically at the relationship of the hips and the spine on one side compared to the other. Now we're going to start going back and forth from one side to the other. So again, using that shin, reaching both hands evenly, and then transitioning across to the other side. You can do your windshield wiper transition from one side to the other. Or you can do your thread through, lifting up that back leg, opening and spiraling it around, threading it through, and then opening it up and reaching back. Now, as we're going back and forth on this, as you reach forward with your hands, start to slide that back leg, open up a little bit more as you're reaching forward. Do the exact same amount on both sides. Again, this becomes a really nice comparison assessment of how does the right hip move in comparison to the left hip. With each reach, as you're each fold, see if you can slide that back leg a little bit further back without going into pain, without going into stress, without going into strain. I want to be nice and light and playful on this one. This should feel good. This should be one of those really soft movements that feel kind of grounding, getting you back into the hips. And then last, we're going to come all the way back to our back, making our big C-shaped hands, placing them around the abdominal wall. Nice inhale, filling up that balloon in all directions. Exhale, navel to spine. Feel the hands squeeze a little tighter so that you have resistance to inflate into. With each one, see if you can expand your balloon a little bit larger, a little bit bigger in all directions. With each exhale, see if you can breathe, get that air more fully, exhale more and more with each one. I want a full expression of that breath. Can you draw it in and get the last little bits out? And then immediately draw in and inflate that balloon. Then allow your hands to soften down to the floor. If you want to let your legs go straight, you can. Now I want to start to feel that breath move up into the ribs, into the upper back, up into the shoulders and the neck. We're still breathing in like a balloon. We're just not focused on the abdominal wall. I want to feel that balloon moving up into the chest and into the neck region, as well as down into the bowl of the pelvis. And we're going to breathe into tension on the inhale, and then on the exhale, drawing navel into spine, allow that tension to melt off your body and onto the floor. Again, each inhale, we're filling up that balloon, which is filling into tension, pushing all that tension out to the edge, maybe up into the chest and the ribs or the upper back, up into the shoulders and the neck, down into the pelvic bowl, and then on that exhale, allow that tension to just release down into the floor. And when you're ready, go ahead and open your eyes.